Hi, Lori. I'm Candace, and we're here today, and we're going to do our complete head-to-toe assessment, okay?
All right.
All right. So first thing we're going to do is we're going to start with the upper extremities. I'm just going to kind of pull this up a little bit where I can see. I'm looking at the skin tone. It's tan. It's obvious you've been out in the sun a little bit this summer. I do see some macules on the arms, dispersed. I don't see any papules or any other abrasions or anything. I want to touch your skin. I'm going to feel the temperature of your upper extremities, and it's warm to touch. The skin is smooth and intact all the way down. Okay, and then I'm going to look at the skin turgor of the upper extremities. Okay, I'm going to just pinch some skin up. We're looking for the elasticity of the skin, which is evidence of good hydration. Okay, I'm going to look at the lower extremities. The skin color is equal with the skin color of the upper extremities. Again, there are some macules dispersed on the legs. I don't see any hair. Do you shave?
Yes.
Okay, so I don't see any hair distribution there. I'm going to touch the temperature of the lower extremities, and the toes are noted to be cooler than the rest of the lower extremities, which is warm and dry. I'm going to touch and feel the intactness of the skin. It is smooth. There's no evidence of edema or any varicosities. Okay? And then I'm going to come up and I'm going to look at your nails of the upper and lower extremities. And your nails are well groomed, they are short, they are clean, the nail beds are intact. I'm going to do cap refill on the upper extremities. That's less than 3 seconds, and then I'm going to do the nails on the lower extremities are also short, well groomed, cleaned, they are painted. I'm going to look at the cap refill on the toes. It is also less than 3 seconds. Okay, so then I want you to do something that we call Shamroth's technique. I want you to take each finger and match it up like that. The next one, and again, and then the thumbs. Okay, and there's no evidence of clubbing, and the nail bases are attached. It's a 160-degree angle for the nail base. Okay, and then I'm going to look at I'm going to look at your head. Your head is symmetrical, well aligned, upright. It's normocephalic. I don't see any evidence of any involuntary movements or tics. I'm going to look at your scalp. The scalp is clean, it's white, no scaliness noted. I'm just inspecting the hair. The hair is brown, coarse, thick. There's no evidence of alopecia, any infestation noted. Okay, then I'm going to palpate your scalp, and the scalp moves freely. Is there any, did you hear anything when we did that?
No.
Okay, no sign of crepitus. Scalp moves freely. And then we're going to palpate the face. We're going to palpate the paranasal sinuses. Any pain or tenderness with that?
No.
Okay. And then we're going to do the TMJ, okay? I want you to open and close for me, okay? I don't hear any clicking or pops or noted, okay? I want you to clench your jaw, okay? I want you to just take your jaw and move it side to side. There you go, and jut it out toward me, okay? The TMJ moves freely. Okay, so then I'm going to test your sensation. We're testing cranial nerve number 5, the trigeminal nerve. This is going to be soft. sharp, and then this is going to be soft, okay? And I just want you to tell me what you feel. So I want you to close your eyes. What do you feel?
Soft.
That's ophthalmic.
Sharp.
That's maxillary.
Soft.
And that's mandibular. And we would do that on both sides. Okay, so now we're going to do facial gymnastics. We are testing cranial nerve number 7. So I want you to smile, not showing your teeth. Smile, showing your teeth. Can you frown? Can you close your eyes tight? Raise your eyebrows. Okay. And then I want you to close your eyes tight and don't let me open them. Okay. I want you to puff out your cheeks. I want you to put your tongue in your cheek and purse your lips. Okay, good job. Okay. And then I'm going to look at your neck. Okay, and your neck, the skin of the neck is in equal color with the other parts of the body. The trachea appears to be midline. Can you swallow for me? And it stays midline when you swallow. Okay, and then I'm going to palpate your trachea. Is there any pain or tenderness with that? Okay, and then I'm going to do that. Let's see your carotid arteries. There is pulsation noted from that, but there is no JVD present. And later in the assessment, we will be listening to all of the arteries, and we will listen to your carotid arteries to see if we hear any bruits at that time. Okay? So I'm going to do the nodes. Okay, the preauricular, you tell me if you feel any pain or tenderness. Postauricular, occipital, submandibular, sublingual, submental, the anterior cervical chain, the posterior cervical chain, and the deep cervical chain, and the clavicular nodes. I don't palpate any nodes. If I did palpate any nodes, I would further assess them to make sure they were freely movable, okay? And now I want to palpate your trachea, okay? I mean your thyroid. Okay, so I'm going to do it from behind, so I want you to kind of put your head down a little bit, turn to the right, okay, and I'm just going to take and push it, and I palpate it, and I don't feel any nodes. Or it's very smooth. All right, turn toward the left, turn down a little bit, and it is smooth and no nodes are noted. Okay. Let me listen to your thyroid, and we're listening for any bruits, okay? Here, just hold your breath. It's no bruits noted. Okay. Now we're going to move on to your eyes. We are testing cranial nerve number 2, which is the optic nerve. And we have already performed the Snellen and the Rosenbaum test. And do you wear glasses or contacts?
Yes.
Okay. So we have performed the Snellen, which is for distance, which you stand at a distance of 20 feet. We have performed that uncorrected and corrected. And the Rosenbaum, which is for near vision, is at 14 inches, and again, uncorrected and corrected. Okay, now we're going to do confrontation, and what I want you to do is I want you to cover one of your eyes. I'm going to cover the same eye, and then we're going to have a bunny come around, and I want you to tell me when you see the bunny. Okay?
Now. Now. Now.
Okay. I'm going to change.
Now.
Okay.
Now.
Okay.
Now.
Okay. All right, and that was testing cranial nerve number 2, optic. Now we're going to test cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens. And so the first thing we're going to do is I want you to follow my pen with both eyes, okay? Here we go. This is the 6 cardinal positions of gaze, and I movement was equal in all areas, okay? And then I just want you to kind of stare behind me, and I'm going to bring a light in, and I'm looking for the corneal light reflex, just a twinkle in the eye, okay? Very good. And then I am looking for, we're going to do the uncover test. So I want you to cover one of your eyes. Okay. I'm going to move my pen in a direction, and I want you to look at that with your eyes, and then we're going to uncover, but remain your eyes looking at the pen, okay? Okay, uncover. Okay, and both eyes track down to the object equally, no signs of nystagmus, okay? All right, so let me look at we're going to inspect the eye. Your eyes are symmetrical. They are sitting in the same alignment on the face structure. Your eyebrows are well approximated and equal. The hair on your eyebrows is equal in color and texture to the hair on your head. Your eyelashes are long and thick, and they point outward. I'm just going to touch right here. The conjunctiva is nice and pink. The sclera is white. The pupils are blue. The lid covers the iris about a third. There's no evidence of lid lag. There's no exudate noted. Okay. Okay, I'm going to look again at I'm just going to look at your pupils, so I just want you to kind of stare behind me, okay? Okay. Okay. And then I want you to look kind of at me. I want you to look at this object out here, and then we're going to bring it in, okay? Okay. And her pupils are equal, round, and reactive to light and accommodate, okay? Let me palpate the lacrimal ducts and lacrimal sacs. Is there any pain or tenderness with that?
No.
Okay. And then I'm going to look on the outside of your, just kind of stare. The cornea is clear, and there is no evidence of bulging of the eyeball. Okay? Now we're going to we're going to do an examination of the internal aspect of your eye. Okay? So first let me turn the lights off. Okay. So first thing I'm going to do, I just want you to kind of look behind me. I'm just going to bring the light up, and I'm going to see if I see the red reflex in your eye. There it is. And right there, there it is. Okay. And then I'm going to get kind of close to you. I'm going to put my hand on your forehead, and I'm going to view the internal structures of your eye. Okay? Okay. Turn the lights back on. I was able to see the red reflex in both eyes bilaterally, and then in that eye was able to go in from the nasal side and see the optic disc, which was round, a creamy yellow. The margins were clear and defined. There was no evidence of physiological cupping. I seen the arteries and the venous system, and there was no crossing or nicking. The ratio was 2 to 3 or 3 to 5, which is normal. Then we moved temporally, and we could see the macula, which is a darker circle. That's responsible for central vision, and then the fovea centralis, which is a white dot inside of there, and that is responsible for the sharpest point of vision. Okay? All right. And now we're going to move on to hearing. Okay? We're going to move on to your ears. Okay, so I'm just going to look at your ear. Your ear is well approximated to the outer canthus of the eye and the eyebrow. I'm looking at the helix and the pinna. I don't see any lesions or any abrasions to the ear. I'm going to see the helix helix recoil is good, okay? And then I'm going to, you feel any pain or tenderness?
No.
Okay, that's the auricle and the mastoid. Now I'm gonna look into your ears, okay? Okay. Oh, sorry. So in the external audio canal, I see some hair and cerumen. I'm able to see the tympanic membrane, which is a pearly gray, clear and flat. And I'm able to see the kind of light, which is at 7 o'clock in the left ear and would be at 5 o'clock in the right ear. I was able to the bony aspects of the ear were visible, which is the umbo, the malleus, the flaccida, and the tens parsa, which is below. Okay, and all of that looked real good. Okay, and we would do that in both ears bilaterally. Okay, now we want to test your hearing. This is testing the cranial nerve number 8, which is acoustic. Okay, I'm going to set off a vibration. I'm going to put it on the top of your head. I want you to tell me if you can hear it in the right, the left, or in both ears. Okay. Okay. And then I'm going to hit another vibration. I'm going to put it on the bony prominence on the back side of your ear. I want you to tell me when you can no longer hear it, and then we will move it around to see if you can continue hearing. Okay?
Now.
Okay. Can you still hear it?
Yeah.
And so what we were testing there is air conduction is greater than bone conduction for the hearing at a ratio of 2 to 1. Okay? Okay, then I want you to occlude one ear, and then I'm going to say 3 words, and then I want you to repeat them back to me, okay? Fall, summer, winter. Did you hear what I said?
Fall, summer, winter.
That's right. And we would do that in both ears bilaterally. Okay? Okay, now we're going to test, we're going to go to your nose. Your nose sits in correct position of the facial structures. The skin tone is equal with the skin tone of the rest of the body. There are a few more macules going across the bridge of the nose. Do you have any pain or tenderness in your nose?
Mm-hmm.
Okay. And then I'm going to just kind of look into your nose. Okay, there we go. Okay. And I'm looking at the mucosa of the nose is moist. I do see the inferior turbinates. I'm not able to see the superior turbinates. And the septum is intact, and I don't see any foreign bodies in the nose. Okay? And then I want you to occlude one nostril. Breathe in, okay? And do the other side. Okay, and that's the patency of the nose. Okay, now we're going to test the cranial nerve number 1, olfactory, and I want you to close your eyes, and I'm going to bring a smell up, a scent up, and I want you to tell me what it is, okay?
Okay. Vinegar.
Okay. And then the other nostril.
Cinnamon.
Okay. And that's again testing the olfactory. Okay, now we're going to move on to your mouth. I'm going to put some gloves on. Okay, so first we're just going to inspect. Your lips are pink and moist, and they're parallel, and they're well approximated on your face. And we're going to just open your mouth. We're going to take a look at your buccal mucosa. It's pink and moist. No evidence of any type of ulcerations. The sublingual area is well vasculated. Okay, let me count your teeth. You have 28 teeth. They're clean, white. I do see, I think, just only one filling. And then I want you to stick out your tongue. The tongue is pink, well papillated.
Oh, sorry.
That's okay. The sides are smooth, and then I'm going to get you to do that for me. I think because of my Okay, there we go. Okay, stick out your tongue. Say
Okay. Sorry.
That's okay. So, the gag reflex is intact, and the uvula, there was nice rise and fall of the soft palate and the uvula, okay? All right, so now what we're going to do is look at your frenulums. The superior frenulum is gone away. The inferior frenulum is intact. I see the Wharton's and the Stinson's ducts. There's no stones noted, bulges, masses. Is any of that tender in there?
Yeah.
Okay.
Oh, sorry.
That's okay. Go this way. Okay, so let me get you to, what we're going to do is do the, I want you to, the cranial nerve, number 10 is the vagus nerve and is innervated by the swallowing, the speaking, and the gag reflex. And number 9 is the glossopharyngeal. We're going to do movements with our tongue. Can you stick your tongue out? Can you move it from side to side? And that's good, okay? That's right. Okay, and then I'm going to get you to shrug your shoulders against resistance, okay? And then I'm going to get you to turn your face toward my hand. There we go, okay. And that is cranial nerve number 11. That is for the spinal accessory. And also we did with the tongue movement cranial nerve number 12, which is the hypoglossal, okay? I think that's all of that right there. And then we're going to move on to the thoracic, the cardiac, and the abdomen part of the assessment, okay? Okay, so first, let me do this. Okay, so first thing we're going to do is I'm just looking at the rise and fall of your chest with breathing. Respirations are nice and even, anterior and posterior. I'm probably going to undo your gown here. I got it. There you go. Okay, all right.
That's
Got
okay.
it?
I'll hold it right now.
Okay. And then I'm going to palpate your chest. There's no thrust or heaves, any pain or tenderness.
No.
Okay. Also palpate on the back. Okay. Any pain or tenderness with that?
No.
Okay. So then what we're going to do is we're going to percuss the lung fields. Okay. So you just breathe nice and normal. Resonance is noted in all lung fields. Then what we're going to do is I'm going to pinch up some skin right here, and I want you to take a deep breath. And I want you to just breathe normal. Yes, okay. And that is thoracic expansion, and it was smooth and even, and my hands came back to the same position that they started. Okay? And then we're going to measure your diaphragmatic excursion. Come forward just a little bit, okay? And then what we're going to do is we're going to just tap on your back some more, and you're going to feel me mark, okay? then I want you to take a deep breath in, exhale it, and hold it there. Okay. And then over on the other side, just breathe normal. Now I want you to take a deep breath in. I want you to inhale and hold it.
Wait, what do you want to do?
Take a deep breath in and hold it. Okay, I'm going to breathe normal. Okay, I'm going to measure it on the other side. Just breathe normal. Okay, and we're going to do the same thing. I want you to take a deep breath in, exhale, and hold it. Okay, relax, breathe normal. All right, I want you to take a deep breath in and hold it. Okay, and breathe normal. We're just going to measure that. And your diaphragmatic excursion is 3 on both sides, and that is normal range would be 3 to 5. Okay? And so then what we're going to do is I'm going to listen to all of your lung fields on the front and the back. Okay? Deep breath in. Out. Again. Again. Okay, good. I'm going to move around to the front and listen. Deep breath. Okay, lung sounds are clear in all areas, anterior and posterior, all lung fields bilaterally. Okay? And the next part of the exam, I'm going to have you lay down on the bed. We're going to start with the cardiac exam. And before that, I'm going to video around the room to show that we have no notes. Okay. Okay?
Uh-huh.
Okay. All right.
You want me to pull my gown down and put this towel over me, or do you would you?
No.
Okay.
We'll just lift it up when you, when we do the, okay. What probably I'll do is I'll probably, is that good? Good. You want to turn it off?
Well, just leave it, I guess. There it goes.
I mean, do you think it'll do it
It's
again?
on Do Not Disturb It if they called a bunch of times.
Okay. All right. Okay. Okay. So now we're back to the cardiac assessment, and I'm just going to look at, I'm just going to pull this down just a little bit, looking at your, I can see some pulsation in your chest. I don't see any heaves or thrust, or, I don't see any JVD present in your carotid arteries. Okay? So just gonna palpate across here, any pain or tenderness. And then I'm gonna palpate in here for the, in the fifth intercostal space for the PMI, or the apical pulse, which is the point of maximum impulse. Now I don't feel any murmurs or thrills on my fingers, okay? All right, so now what we're gonna do is I'm going to listen to your heart sounds across your chest. So you just sit there nice and relaxed, okay? Now I'll be talking a little bit while I'm doing it. Okay, so in the right second intercostal space, this is the aortic. We're listening to sound S2. In the left second intercostal space, it's the pulmonic. Again, S2. The third intercostal space on the left side is Erb's point. It's S1 and S2. The fourth intercostal space is the tricuspid. You can hear S1. And then on the fifth intercostal space is the mitral valve, and this S1. And I'm going to go back over all those areas with the bell of the stethoscope. There were no murmurs noted. There was also no S3 or S4 sounds noted. Good normal heart sounds all the way through, okay? All right, so now I'm going to do your pulses, okay? I'm going to palpate your temporal pulses. I'm going to do your carotids one at a time. Pulses. And then I'm going to do the radial pulses. And then I'm going to do the, get your legs up just a little bit, popliteal pulses. Okay. And then I'm going to do the posterior tibial and the dorsalis pedis. And all of those pulses were smooth, even, strong pulses, no thrills or threadiness noted, okay? Now I'm going to listen to all of those pulses, okay? And then I'm going to listen to some pulses on your abdomen at the same time, okay? Hold your breath. Listen to the aortic. Iliac. I'm going to palpate the femoral and then listen to it, okay? I'll just do it one side at a time. If you can just kind of get your leg out a little bit. Okay, and the other side. Bend your leg, right side. Okay, and then I'm going to listen. Okay, and there were, again, no murmurs, no thrills, no bruits noted in any of those areas. Okay, now we're going to move on to the abdomen. Okay, I'm just going to inspect the abdomen. The abdomen is nice and flat. I don't see any signs of pulsations. I do see respirations. I don't see any peristalsis. I see the umbilicus is inverted. The skin is a little lighter color than the extremities and the areas that are more exposed to sun. I do see a few macules, no abrasions or lesions other than that noted, okay? And now what we're going to do is listen to your abdomen, okay? Just listen over your organs, the liver, the spleen. Okay, so bowel sounds were noted in all 4 quadrants at a rate of 5 to 35, which is normal, and over the organs, there was no friction rub noted, okay? So now we're going to percuss the abdomen, okay? So I just want you to sit nice and relaxed. That was Tiffany located in all those areas. I went ahead and percussed over there by the spleen. I could hear dullness on the costrovertebral margin. And then tympany, which means the spleen is nice and protected up under the ribs and we will not be able to palpate it, okay? I need to get a measuring for your liver. Okay. So what we're going to do is just sit nice and relaxed. Measure that. It measures 6, which is normal for the width of the liver, which would be 6 to 12 centimeters, okay? Now we're going to palpate the liver and attempt to palpate the kidney, okay? So I'm just going to put my hand up under you, just kind of want you to relax inside of me, okay? I want you to take a deep breath in and hold it. Okay, and we're able to feel the liver, and it is smooth, no nodules noted, and firm, okay? And then we're going to try to capture a kidney. Okay, take a deep breath. Okay. And I'm unable to capture a kidney, but if I were to able to catch one, it should be smooth, firm, and no nodules noted, okay? All right, so I think we're going to move on to the musculo. You can pull it out. You might want to leave the towel right there. The musculoskeletal assessment part of the body. Okay, so I want you to bring your leg all the way up. This is flexion of the hip. Bring it down. This is extension of the hip. We will do hyperextension of the hip when we get off the table. Okay, so I want you to do. Bring your leg out toward me. That's abduction. Then bring it in and across. That's adduction of the hip. Then I want you to do sit like a man. This is external rotation of the hip. And then knee to knee is internal rotation of the hip. And we would do that bilaterally. Okay? Now I want you to do some of those against resistance. Okay? Can you bring your leg up? Okay, leave it up. Can you bring it down? okay? Can you bring it out? Out, toward this way. Yeah, there you go, and then leave it out and bring it in. Okay, good. Okay, now we're gonna move on to your knee. Bring your leg up. Okay, can you bend your knee? That is flexion of the knee. Bring it out. That is extension of the knee. And we do not hyperextend the knee. Okay? And we're going to move on down to the ankle and the feet. Can you point your feet down? That is plantar flexion. Can you pull them up towards your head? That is dorsiflexion. I'm going to lift your ankle here. Can you rotate it? That's range of motion of the ankle. Can you bring your heel in? That's inversion. And can you point it out? That's eversion of the foot. Okay, can you point your feet down against resistance and then bring them up? Okay, very good. And we would not do the range of motion or the inversion or eversion with the
Resistance.
with the resistance with the range of motion or the inversion or eversion. Okay. Okay. I think that's all. All right, we're gonna get you to stand up. Take your time. Look at that. Okay. First thing I want you to do is to take your leg and take it behind you and hyperextend it. That's hyperextension of the hip. Okay. And then I'm going to get you to walk toward the camera. Okay, that's normal gait. Turn around and I want you to walk back heel to toe. Okay, very good. Okay, then I want you to kind of stand here in front of me. Toward this way. There you go. And then I want you to separate your feet a little bit. Close your eyes. Okay, and that's the negative Rombergs. Okay, and I want you to stand right here in front of me. Okay, and then I want you to take your arms out, and then I want you to touch your nose with each finger with your eyes open, again, okay, and then do the same thing with your eyes closed, okay, and that's good, okay, and then I want you to sit down on the bed and cross your legs. And then cross the other way, sit like a lady. There you go. Okay, and that's demonstrating strength of the hamstrings, glutes, and the quads. Okay?
That's what I measure myself out.
Yes. Okay. Stand in front of me. Yeah, are you on the camera?
Emma?
Okay. I think so. Okay. Okay. So what we're going to do is we're going to do the range of motion of the neck. Okay, I want you to flexion, extension, hyperextension, bring it back midline, and I want you to turn it side to side. That's rotation, and then ear to shoulder, and that's lateral. Okay, and then I want you to do some of that against resistance. Bring it forward, bring it back. Okay, side to side. And ear, and again. Okay, good job. Okay, now we're going to do range of motion of the shoulders. I want you to bring your arms up like you're diving. That's flexion of the shoulder. Bring it down, that's extension. Bring it back, that's hyperextension. Then we're going to bring them out, that's abduction. Then bring them down and across, that's adduction. Then bring them out behind your head, that's external rotation. Bring it down across your lower back, that's internal rotation, okay? I want you to do some of that against resistance. Okay, forward, back, bring them out, and then leave them out and bring it in. Okay, good job. Okay, now we're going to do your, the elbows, okay? So can you bend the elbow? That's flexion, straighten them, extension. We do not hyperextend the elbow. Can you do supination, pronation? Okay, do supination, bring your arms up. All right, bring them down. Okay, good job. Okay, now we're going to do the wrist. This is flexion, extension, hyperextension, then bring them back, and we're going to do ulnar radial deviation. Okay, and then I want you to raise your hands up, push them down. Okay, and we don't do resistance on the ulnar radial deviation. Now we're going to do the fingers. I want you to do flexion, extension, hyperextension, abduction, adduction, and I want you to do opposition, okay? I want you to touch your thumb to all your fingers. Then when at the pinky, I want you to do it at the base of the pinky. Okay, good job. Okay, then we're going to test that. So I want you to bring your fingers up, bring your fingers down. Okay, I want you to separate your fingers out, bring them in. Okay, then I want you to open your grip. Okay, and then I want you to grab me. Okay, and grip is equal and symmetrical. I think that's all of that. Okay. So, let me get you to do this. We're going to do, I want you to do your hands over and under as fast as you can. Okay, that's good, okay? And then we're going to do flexion of the of the spine. And then we're going to check for scoliosis. And we're checking for the cerebral muscles and the cervical spinal process. Any pain or tenderness with that?
No.
Okay, and then you can come on up. Then that's extension of the spine, and then bend back, hyperextension of the spine, and then rotation of the spine, and then lateral bending, side to side. Okay, good job. Okay. Now we can have a seat. Okay. So we did those things, and now we're going to do the pain point. This is sharp, and this is soft. And I want you to close your eyes, and I'm going to touch you, and I want you to tell me, point where it is, and tell me what sensation it is. Okay?
Okay.
Are you ready?
Soft. Here.
Okay.
Sharp. There.
And we would test that on all extremities, upper and lower, and on the core. Okay? And then I'm going to get you to close your eyes, hold out your hand, and I'm going to put an object in there, and I want you to tell me what it is.
A coin.
Okay? And that is stereognosis. And then I'm going to test graphesthesia. I'm going to draw something in your hand, and I want you to tell me what it is, okay?
A 3.
That's correct. Okay. Let's see. Now we're going to test position sense on your fingers and your toes. And this is up, this is neutral, and this is down. Okay? So I'm just going to take one. You tell me what it's doing.
Down.
Okay.
Up.
Okay.
Down.
Okay. And we would do that again on upper and lower extremities. Okay? Then we're going to test vibration sense. I'm going to hit this. I'm going to put it on a joint, and I want you to close your eyes and tell me when it stops. Okay?
Okay. Now.
Okay.
Now.
Okay.
Now.
Okay.
Oh, now.
That's okay. That's okay. So, and again, we would test that upper and lower extremities and bilaterally. Okay? Now we're going to test your reflexes. Okay? So first thing we're going to test is your tricep reflex. So just relax. Okay? And then we're going to test the bicep reflex. Just kind of relax. Okay? And then we're going to test the brachial radialis. And then we're going to test the patellar. So I want you to kind of grab your fingers like this and turn your head. Okay? And then we're going to get you to hop up on the bed, and we're going to check your Achilles tendon reflex. Okay? Watch your head.
Oh!
Watch your head. All right, move up a little bit. Good bit. Okay. All right, straighten up.
Okay. Oh, you'll be stood up.
Okay. Let your feet kind of hang off. Okay. Okay. And they're at 1+. Okay. And that concludes today our head to toe assessment. Okay.